Hello and welcome back to our signature segment, See the Stories. Before we begin our talk show, I would like to ask something to Rory. Have you ever joined a volunteering activity or organization that helps people and also have good impact before?
I actually joined once, very briefly, but then I participated in this voluntary program within my own brand actually, and we worked together with this organization to help children living with HIV in Solo, Central Java. So that's what we did through our brand, so not joining that organization per se. What about you anyway?
I was once in Abang None, Jakarta, and you usually conduct as well social activities, helping people that was impacted by flood in Central Jakarta and other parts of Jakarta as well.
Yeah, it feels fulfilling, right?
Yes, and especially for the kids and the mums, because the kids, they probably had some kind of mental issues or something like that, but they did not really tell anyone. So we just, involved them in some activities just to make them, feel okay again. Yeah. So now, speaking about organizations that help people and delivering good impacts, our guest today is from one such organization. The organization is called Médecins Sans Frontières. I don't know whether I say it correctly or not. Or Doctors Without Borders, which sends volunteer medical personnel to crisis areas to provide assistance to people who are marginalized or affected by disaster. Now, joining us in the studio is Head of Mission for Doctors Without Borders in Indonesia, Gabriele Santi. Hello and welcome.
Hello, Gabriele.
Thank you very much. Good evening.
Good evening. So you've been here in Indonesia for quite some time, a year and so. You sort of told us, before the session start. So as Doctors Without Borders operates in more than 70 countries around the world, including Palestine. First, could you tell us the latest updates of conditions in Palestine today?
So actually, the situation is quite appalling. And as we just released a report lately, in late December, and the title is Gaza, Life and Death Trap, is pretty much describing the current situation over the last 14 months. So since the attack of Hamas that occurred on the 7th of October, and that killed 1,200 Israeli people, and the retaliation that was being made by the Israeli forces that pretty much targeted the entire population in Gaza. We're talking about a massive devastation towards the population. Everybody knows there is more than 45,000 people has been killed. We're talking about 100,000 people injured physically and mentally. We're talking about 90% of the population is forcibly displaced within the country. We're talking about massive destruction of infrastructure, especially hospitals.
Yeah, I mean, you can see in the picture behind
hospitals, so where the people were supposed to be taking care are being targeted. United Nations give information about that more than 500 healthcare workers being killed. MSF staff, we lost 8 colleagues, and many of the family members as well. Beside this one, the aspect of the constant denial of access of items like water, food, and medical supply, these are basic items, are of course affecting massively what is the possibility to support the population in the place.
Now what we see in Gaza,
your operations.
Your operations in Gaza.
So this is mostly supported hospital and health center dislocated mostly in central and southern part of Gaza.
Are they still operating right now?
Yes, this is a current update to the November current operation that we have in Gaza. This is not run by only MSF, but it's pretty much supporting those centers. There are 2 hospitals, 5 primary healthcare centers, and it means the operation is mostly surgical wound care for sure. That is related to people that have been affected by and injured by the war, orthopedic surgery, but also maternity and support, pediatrics in terms of primary health care. We talk about outpatient department support, health promotion, dressing, everything is related. So it's pretty much a diversified type because the massive need are
We now learn, Gabriele, that many of these hospitals are under attack and they are even destroyed, demolished by the Israeli army. including Indonesian hospital, Al-Aqsa Hospital, that was, set or believed by the Israeli army to be the host of command center of Hamas, right? And it is proven not true. But under this kind of heavy bombardment and demolition, are you guys still being able to operate and help people there?
The major problem is about not only these hospital and center are being targeted, and so that most of them not functioning. We talk about like 19 hospitals not functioning anymore, 75 primary healthcare center not functioning anymore. The difficulty is also bringing in the materials, not only the fact that and this is becoming very complicated. Another thing that we have faced is the difficulty to medevac people that require further support that it cannot be provided inside Gaza. That is quite appalling as well, quite dramatic.
Wow.
But with this current situation, though, food is really hard to get in. Medical equipment, medical aid is really hard to get in. Then how do you guys keep supporting and surviving?
It's a massive passive negotiation that you have to have with the Israeli authority, and to be able to provide as much as possible information. I thought probably you heard about the difficulties to how many trucks are able to enter after so much long queuing. So it's possible to bring in help and support and aid, but of course is not absolutely enough. Mainly because with such much displacement, the population in Gaza has the difficulty that and move back and forth in different locations. The condition of hygienic condition are worsening, and so automatically lots of other diseases are popping up. That's the reason why it's really crucial to have definitely a ceasefire. I heard about before there were discussion and talk ongoing, but it is quite crucial to provide the relief to the population.
We've heard about how Gazans, they were crying out loud and saying that we live unlike humans. That's what they said. They live like animals, that's what they said. So back to Doctors Without Borders, what types of health crisis or emergency situations that you have encountered in Palestine? How was your team responded in such emergency situation?
This is, pretty much the conditions are difficult. When even the healthcare setting are targeted and is becoming quite difficult to support the population in the country. That is the fact of why the number of people that are dying are quite so high. There was also an estimation that is written in this report from Lancet that the consequences of the wound, not related to the wound particularly, but all the other people that have chronic diseases like NCDs, or people with probably with oncological disease.
Or skin disease.
Yeah, everything is getting worse because there's no possibility to support. So they do what they can do. And that's the reason why it's essential to provide a start with the ceasefire and reach an agreement to finally provide a clear support to the population.
Are you quite optimistic about the potential agreement, or it is bleak?
Based on the situation on the ground, let's say.
Politically speaking, I know that there's a lot of pressure from different angles, and we really hope as a humanitarian organization that they will reach a possibility to have an agreement to open up the possibility to give relief to the population.
And if you could give us a view, if this stays like this without an agreement reached, what would it be? What are we expecting?
Under the human point of view, I would say that it is a shame to be a human being. Because assisting from outside and not being able to save life and leave people dying in constant situation is absolutely shameful.
I can imagine the burden and the danger that health professionals are facing there, because it's not only hospitals, but even ambulances. And even doctors and nurses are being directly attacked by the Israeli army. So with this kind of situation, plus the famine inflicted by Israeli army and the phosphorus attack, relentless bombardment, what is your current focus? What can you do amid this, limitation and bombardment?
This is pretty much what was written in that map, is providing and supporting wherever is possible, whenever you have the availability of medical supply that can allow you to save life. There's several witnesses within also this report that is quite appalling. They are utilizing particular medical items for one person to another one.
Wow.
And because there's no other.
Yeah, just being creative as much as possible.
Exactly.
Save
That is
lives.
the
Well, okay, you're operating in 70 countries, including Sudan and also Indonesia. We're not having any such, catastrophe like what Gaza are having. But what is the importance of voluntarism in your point of view in organizations such as Doctors Without Borders, and how can Indonesians get involved?
We are operating, as you say, like in many different contexts, at least like related to man-made disasters, like such a conflict situation, epidemics. We're working in natural disaster situation as well, with population that are excluded from healthcare, for instance, like we're talking about refugees in many different contexts in the world, like in Southeast Asia. There is the situation of Rohingya in Myanmar, for instance, and there are 1 million Rohingyas in Bangladesh, for instance. So we are working in many different situations, and we have a variety of staff. And our staff is not only medical staff. We have for sure medical doctor, nurses, midwife, epidemiologists, any type of specialist, but as well we have other professionals, so administrator, we have logisticians, we have high CT expert and so on. So there is a multiple possibility for anyone to be part of that. It's just a matter to participate to the recruitment process that is centralized, and it could be possible identified through our website. There's a clear process of the recruitment.
Right.
So.
Just what Alia pointed out about Indonesia's your focus on Indonesia, right? Now your focus is emergency hub projects that you're doing with your peers.
Yep.
Can you elaborate more about emergency hub project that you're doing in the country?
Yes, this is a project that has been started in 2023 in the previous MOU, and has been further developed, I would say, with the new MOU that we signed recently in 2024, in March 2024, with Health Crisis Center of the Minister of Health, in Indonesia. And the collaboration we established was try to upgrade and try to support as much as possible medical personnel and non-medical personnel that are supposed to be the responder to emergency crises related to natural disaster. So together with the Ministry of Health, as well also the technical department and our own technical department inside MSF, we try to create ad hoc specific type of training around 4 domains. We are going to develop also a 5th domain this year. And the 4 domains are, of course, medical support in services in emergency, mental health support in emergency, as well GIS, that is a Geographic Information System, and environmental health related to emergency situation. And what we were going to develop this year will be also health and logistics in relation to management of medical items. And so on.
All right. Well, we would like to explore more about your collaboration or working with Dokter Lintas, Batas in Indonesia, and I'm trying to imagine how your work, Doctor Without Borders, are reaching out to villages that are not even in the map. I mean, maybe you have experiences that you could share with us here. How is it like working with Dokter Lintas Batas?
Actually, as MSF Indonesia, so Dokter Lintas Batas, we run this emergency hub.
Translation of that.
Yes, it's just, Dokter Lintas Batas is MSF Sans Frontières, or Doctors Without Borders, is the MSF Indonesia base. And as I said, we are dealing with these emergency preparedness and capacity building and possibility to respond in collaboration with the Health Crisis Center of Ministry of Health. And that is what we be identify is like those areas that are much prone to disaster.
Yep.
And And as well, those provinces, they have, let's say, less capacity and they need to be a little bit more support. And that was an agreement we have with the Ministry of Health. And that's the reason why initially for 2023, 2024, we started with Banten and 2024 was also with Aceh province. And next year we will roll out in other 2 provinces. There will be West Sulawesi and Maluku in relation to our MOU that we are currently doing.
Well, this is a country that is, has many natural calamities and challenges in terms of geography, right? And you mentioned that you've been in the country for more than a year. Has there any been rewarding experience that you got while you're in Indonesia, and what is that?
But in relation to our current job, I would say that it was quite fascinating to see how much the enthusiasm of the participant to our training, because we have people that work for a different level within the Ministry of Health, so at level, provincial level, at the district level, Puskesmas level, but as well also some NGOs like the Indonesia Red Cross, Muhammadiyah Disaster Management Center, the Medical Association of Indonesia, the Medical Association, as well the Nurse Association. They collaborate with us. They also participate with us to provide and facilitate the training. And the great point is to see how much the people that participate to this training is not only enthusiasm, but they put so much energy because they are really eager to not learn, but also to be effective as emergency responders when things may happen. So that's really, really rewarding.
So knowing that people are into volunteerism, so this is what you feel that as a big reward to what you're doing is part of Doctor's
I think personally is mostly there's a lot of people that need and it's a matter of choice. I work with the Doctors Without Borders and myself since 20 years. I've been working in many different context scenarios, from emergency response to much long-term project, as you mentioned before, HIV project in some other context, like in South Africa. And is the humanity beside that. It's not just
doing projects.
It's the humanity that you meet in this type of work is quite priceless.
And that's rewarding to you. So thank you so much, Gabriel, for your time.
you.
And thank you so much
For
your
doing
contribution.
this.
For doing this. And for your
Such
peers
trouble.
who have risked their lives, especially in conflict areas like in Gaza right now, as you see. Hopefully the crisis or the genocide will stop, and we will see more aid, medical aid and food supplies get into the strip. So thank you very much for the service.
Thank you very much.
Thank you very much.
All right, so the stories will still continue after the break to talk about organizations that are making a significant impact on the globe. So stay with us.